So please introduce yourself and what you practice.
Oh, okay. I'm Suruchi Gupta. I'm an MD and I practice endocrinology at Harvard Vanguard Medical Associates in Boston.
Can you please give us an overview of patients who have developed diabetes due to PCOS?
Overview of patients.
Like
Overview
essentially,
meaning
like the link between diabetes and PCOS. It's just an explanation on it.
oh, okay, interesting. So basically PCOS is associated with an increased risk of prediabetes, okay? And then so pre-diabetes is the stage where, you do not have diabetes yet, but it's right before you develop diabetes. And then also if you don't take appropriate medications or precautions, then you progress to type 2 diabetes. We think it's predominantly due to insulin resistance, which happens because of obesity in patients with PCOS.
Okay. Can you explain how PCOS causes metabolic syndrome?
So, PCOS does not cause metabolic syndrome. It's like interchangeable. We don't know if it's PCOS causes metabolic syndrome or metabolic syndrome is associated with PCOS. They kind of go hand in hand. So, PCOS symptoms do get worse if, the patient is obese. So basically PCOS is also, PCOS patients are at a higher risk of developing obesity, or the PCOS gets worse if you're obese. So if you have PCOS and you're already obese, you have worse symptoms, unfortunately.
So,
Um,
what are the new treatments for weight loss and diabetes that are available for women with PCOS?
That's a great question. So we initially used to use metformin, but lately there's this whole class of medications called as GLP-1 receptor agonists. One of the names you might have heard on the media is Ozempic. So basically it's a medication which lowers your blood sugars, and it also causes weight loss due to reduced appetite. So the class of medications is GLP-1 receptor agonists, and some of the brand names are Saxenda, Wegovy, Ozempic, Trulicity, and so forth.
okay. What are the diagnostic tests for PCOS? Like people who have diabetes and metabolic syndrome. Like, what is the diagnostic process?
Yeah, so PCOS is actually a diagnosis of, it's a syndrome, meaning, it's if you have three of the four, or if you have three symptoms, then you qualify that you have PCOS. So some of the four things are, the first one is hirsutism, which means that you have excessive hair growth on your face or all over your body, more than what you would normally see in your family. So that's called as hirsutism. Um, uh, it also is associated with a lot of acne. Then the second one is if you can see polycystic ovaries on the ultrasound. So, people do ultrasounds and then they have polycystic ovaries. The third is irregular menstrual cycles. So if you have irregular menstrual cycles, so actually two out of any of those three, if you have two out of any of the three, then you have PCOS.
Can you explain how PCOS can lead to insulin resistance?
Um, so basically, PCOS patients have, usually they tend to be obese, and that's unfortunately what causes the insulin resistance. And there is also a direct link of PCOS and insulin resistance, and we're not sure the exact mechanisms of that, but we do know that that occurs. But it's usually the link is through obesity.